Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Ergonomics is one of the foundational baseline components of the skill development and practice of instrumentation. Much of the time you spend in pre-clinic will be focused on operator positioning, your posture, your patient positioning, the proper positioning of the light and the instrument tray, as well as the grasps that you're using associated with how you hold an instrument. This allows for precise instrumentation without injury or musculoskeletal stress. This episode will cover the basics that surround ergonomics and the dental hygienist as it relates to patient and operator positioning. Hey, if you're in hygiene school or just got your acceptance letter to hygiene school, I've got a new course to help set you straight right out of the gate when you first start your program to help ensure a successful transition from the first semester to the second semester and to the finish line. I will help you strategize all the key strategies that you need, understand what the challenges are, and overcome all the obstacles. Learning in dental hygiene school is different than any other program. You've got a lot of assessments that are evaluation style. You need to be able to plan and prepare for that and be successful so that you can become an RDH. And I'm here to do that for you. I have a new course, How to Be a Successful Dental Hygiene Student. You can click the link right in the show notes and I'll show you how to get it done. Congratulations on entering this profession. When we are functioning in a dental laboratory with ergonomics located at the center of what we are doing, we're accomplishing what we have set out to do in a very efficient way, and it occurs with relative ease. Our equipment fits our body, and we, as a result, do not need to stretch excessively and do repeated motions that are inefficient. When our environment is comfortable, we are productive and safe at the same time. A dental hygienist is at a higher risk of musculoskeletal injury as a result of the excessive use of our small hand muscles, the repeated motions that are needed in our hand and our wrist and our back. We have tight grips with our hand and fingers, and when we are in a static working position, it only exacerbates the risk that we face in any type of injury related to the profession. An injury to the back, shoulders, arms, and neck, or other area can happen when we are trying to perform our job without keeping proper ergonomics at the center of what we are doing. Our profession, by its very design, is at a higher risk of injury. Now, knowing this at the beginning, before you even start learning about the profession and all that's required of you and your body, really helps you to create a focus on proper ergonomics in all that you do to ensure that you have a long and healthy career. Now, starting with the operator posture, a clinician should use an operator stool that allows them to adjust to the height so that their feet are flat on the floor and the upper thigh is just about parallel to the floor, maybe a little bit tilt downward. The seat tilt should be slightly lower at the front, just behind the knees, and the backrest should be adjusted so that there is support for the lumbar area. A lower back that's unsupported tends to strain and create changes in the natural shape of the spine, so you want to make sure that you have that support. In a neutral seated position, your shoulders are relaxed and your head, your neck, and your back are in proper alignment. Your feet should be spread apart to allow for that additional support that runs from head to toe. So think of your whole body as part of the whole process of performing the task that you're doing. Now, taking the time to make all the necessary adjustments to the operator stool goes a long way in helping you, the clinician, reduce the risk of stress and strain. Having a neutral and centered posture will help reduce stress and strain and help you maintain a full range of motion while you're performing a task. Now that you have an established neutral position for you, the clinician, let's take a look at how we can best position our patients to allow you, the dental provider, to maintain proper ergonomics and a neutral position while treating your patient. Taking the time to properly position your patient is an important step to help reduce the risk of injury or fatigue. Let's start with the patient positioning when you're working on the maxillary arch. The back of the chair is lowered down until it is almost parallel to the floor. The patient's feet should be nearly even or just slightly higher than the nose. The headrest should be adjusted to allow the patient to comfortably have a chin-up position. Now be sure that the neck is supported, so the patient's headrest may need to be adjusted to allow for a neutral position that is supported. This position for treatment on the maxillary arch is known as the supine position. Now let's look at the position of the patient when we are working on the mandibular arch. The back of the chair is lowered into a semi-supine position where the back is not quite parallel to the floor. It's raised just slightly higher, or like 20% or so, to the angle of the floor. The patient's feet should align with the nose. The headrest should be adjusted to allow the patient to comfortably be in a chin down position. Whether the treatment is being performed on the maxillary or the mandibular arch, the clinician should establish a neutral position prior to performing any treatment. The clinician's elbow should be just above the patient's mouth. Now, establishing the correct height of the patient will enable you, the clinician, to perform treatment without bringing your arm out of a neutral position. You, the clinician, should work as close to the patient as you can in order to increase your visibility while still maintaining a neutral position. In some instances, you may be able to straddle the headrest, and this will enhance both your visibility as well as your neutral posture. Now that you have your operator stool adjusted for a neutral position and your patient has been correctly positioned for the arch that you're working on, the next thing you want to address is the position of your patient's head in order to increase your visibility in all the areas of the mouth while still maintaining a neutral position. For the maxillary arch, the patient will raise their chin and have their upper arch visible to the clinician. The headrest is angled up and back to allow for support of the neck, with the patient being in this position so that they're comfortable. For the mandibular arch, the patient will lower their chin and have their lower arch visible to you. The headrest will be angled forward and down to allow for support of the neck with the patient in this position. One additional component of the patient's head position is that it is vitally important to maintaining a neutral position and reducing fatigue and injury, but can easily be overlooked, is to adjust the patient's head position to increase your visibility in all the treatment areas. For specific areas, it may be necessary for you to have your patient turn their heads towards you, have them turn their heads away from you, or maintain a neutral position. Although most dental professionals use a loop light, it is still very important to understand the proper positioning of the overhead light in the operatory. When you are working on the maxillary arch, the overhead light works best if it is positioned directly over the patient's mouth or angled slightly towards the neck area. Now remember, the patient's head is in a chin-up position when you're working on the maxillary arch. You want to be sure that the light is always within reach and it provides adequate illumination in order to maintain good visibility. When you're working on the mandibular arch, the light is positioned directly over the mouth. Keep in mind, the patient is in a chin down position, and you don't want to have the light too close to the patient. It's very common to have to make a slight adjustment, especially if you have your patient move their head left or right. You might have to make adjustments with the light. The instrument tray needs to be positioned in an area that makes it easy to reach. And remember, you're going at it a lot of times in the course sequence of one appointment. So you're accessing the instrument tray repeatedly during a procedure. So you want to make sure it's in a position where you're not creating additional stress or excessive strain on your body. As a general rule, the instrument tray is positioned so that it's within reach of your dominant hand. So now that we've discussed the basics around equipment and operator positioning, the patient chair and the head positions, we can discuss clock positions as they relate to the different treatment areas of the mouth. During instrumentation, the clinician changes into a variety of different positions, and this allows for maximum visibility while still maintaining that neutral position. Consider that as a clinician, it is essential that you understand ideal positions for yourself and for your patient, depending on the area of the mouth that you are treating. Using a basic analog clock as a reference, the patient's head is positioned at 12 o'clock, with their feet at 6 o'clock. So for the right-handed clinician, most of their positions will be between 8 and 1 o'clock, based on the areas that they're treating. The left-handed clinician will position themselves at 1 o'clock to 4 o'clock, based on the areas that they are treating. Now, use of the 8 o'clock position for the right-handed clinician or the 4 o'clock position for the left-handed clinician should be minimally used because it is almost impossible to maintain a neutral position when you are in 8 o'clock or 4 o'clock treating your patient. And a great way to get yourself in the right position is to ask yourself a systematized question. Me, where am I supposed to be? My patient, where's my patient supposed to be? My equipment, where's my equipment supposed to be? My hands, where are my hands supposed to be? You will need to know the proper positions to remain neutral and be able to perform proper instrumentation. And while you may feel as though you need to memorize the areas as they relate to the positions, it may be more beneficial for you to learn to recognize the patterns among the positions. So for teeth surfaces that are facing towards the clinician, instrumentation is performed at 9 o'clock for the right-handed clinician and 3 o'clock for the left-handed clinician. For teeth surfaces that are facing away from the clinician, instrumentation is performed at 10 to 11 o'clock for the right-handed clinician or 1 to 2 o'clock for the left-handed clinician. So now let's get a little more specific. For the mandibular anterior surfaces, both facial and lingual, facing towards, that means the surfaces that are facing towards you, the patient will have their chin down and have their head positioned either neutral or towards the clinician. Slightly, okay? And this is just ever so slightly. And this will improve the visibility of the right-handed clinician. They'll be seated at an 8 or 9 o'clock. And the left-handed clinician will do the same with the patient's head and be seated at 3 to 4 o'clock. For the mandibular anterior surface, both facial and lingual facing away, the patient will have their chin down and have their head positioned either neutral or slightly towards the clinician to improve visibility. A right-handed clinician will be seated at 11 to 1 o'clock, and a left-handed clinician will be also seated between 11 and 1 o'clock. For the maxillary anterior facial surfaces towards, the patient's chin is up, The patient's head rests in a neutral position or is slightly towards the clinician. The right-handed clinician is seated at 8 or 9 o'clock, and the left-handed clinician is seated at 3 to 4 o'clock. For the maxillary anterior facial surfaces away, the patient's chin is up, the patient's head rests in a neutral position or slightly towards the clinician. The right-handed and left-handed clinician is seated at 11 to 1 o'clock. The lingual surfaces of the maxillary anterior teeth, both towards and away, are accessed with the patient's chin up and the head is in a neutral position. The right and left-handed clinician are seated at the 12 o'clock position. It's important to remember the basics. Chin up for the maxillary arch, chin down for the mandibular arch. Then apply the more specific situations for each specific area to maximize your visibility and comfort. Remember that the patient is only in your chair for 45 to 60 minutes in a private setting after you have obtained all your skills. You are seated in this chair for a full day, so it's really important that you keep your posture and your ergonomics very, very up front so that you can dictate to your patient what the needs are so that you do not injure yourself. They may need to make adjustments in how they are seated in the chair for a very short amount of time so that you can perform what you need to do and be able to do it for a long time, an entire career's worth. One thing that I just want to add is that when you are in your preclinical rotation, depending on the school that you attend, you may find that the faculty will simplify your patient operator positioning at first when you're learning, and there might be some discrepancies between what you're being taught and what's in the book. Typically, what the faculty will do in the preclinical situation is instead of telling you that the position could be from 11 o'clock to 1 o'clock, they may just tell you to stick with 12 o'clock for now as you're learning. There's less involved with what you have to learn because at first, when you're learning patient operator positioning, it's more of a memorization process. And then once you're able to apply that information and work with your typodont and then in the future work with a real patient, it will kind of become just second nature. But at first, when you're learning the material, it's very much a memorization process. So you may find that although your books may say that sextant 2 facial surfaces away, that you sit from 11 to 1, whether you're right-handed or left-handed, you're going to be told by some faculty to just sit at 12 o'clock because it makes it easier for you to learn. The other thing that I just want to point out is that big picture learning is that in general, when you are working on surfaces towards you, your patient will be looking away. And when you're working on surfaces that are away from you, your patient will be looking towards you. And so in your book, you'll hear that there's a neutral position or slightly towards or away. So as I said, in the preclinical setting, we may just tell you the very basics and simplify it a little bit so that you can just develop the understanding at first, and then we'll further refine those skills of the patient positioning and clinical operator positioning as you work through the process of your instrumentation skills and you're able to apply the patient operator positioning to the actual instrumentation and practical setting. I hope that makes sense for you. A short little poem by Jim O'Donnell. Ergonomics is the design to keep your comfort in mind, to stop all that repetitive strain so that you don't end up with aches and pains. Keep that in mind as you continue to grow and learn that the ergonomics is the place where you need to go back to be sure that you are in the right position. Thanks for listening today. In the next episode, we are going to be talking about the design characteristics of the standard straight ultrasonic tip and compare those design characteristics to the design of the periodontal probe. Now, the probe is one of the first instruments that are introduced in your preclinical rotation. Taking the time to relate the similar traits between those two instruments will really help you as a student develop a baseline for use of ultrasonics in the clinical setting, which tend to have a bigger learning curve. So you don't want to miss this one. I would invite you to ask any questions at all that you need answered. Sometimes questions come up when you're listening to this podcast. If you have a question, most likely someone else has the very same question. I'd be happy to answer it and would probably share it in a future podcast.